Welcome back. Today we're diving into a topic that's near and dear to my heart, the often overlooked and misunderstood world of adult ADHD. We all know ADHD is a condition that affects children, but did you know that it continues to affect many individuals into adulthood? And I mean many. Research shows that around 4% of adults worldwide have ADHD. That's about 8% of us here in the US. But here's the kicker. Only 30% of those with ADHD in the US have received a diagnosis. It's a silent struggle that can throw your life into a tailspin if not properly understood and managed. Today, we're going beyond the stereotypes and misconceptions to bring you the most up-to-date insights on this complex condition. I'm talking causes, symptoms, diagnosis, and the latest treatment options. Whether you suspect you might have ADHD or just want to learn more about it, this video is for you. So buckle up, grab a notepad, and get ready to unlock the secrets of ADHD. Let's get started. Before we dive into our list, let's explore what actually causes ADHD. While the exact cause remains unknown, research suggests a combination of genetic and environmental factors play a role. Genetics, brain structure, and neurotransmitters are all on the list. Interestingly, studies have shown that people with ADHD have reduced levels of dopamine and norepinephrine, which impacts attention, focus, and impulse control. Environmental factors such as lead exposure during pregnancy or low birth weight also seem to play a part. Now that we understand the why, let's talk about the how. How do you unlock a diagnosis of adult ADHD? Well, it starts with recognizing the signs and seeking help. The first step is to schedule a clinical interview with a healthcare provider. During this session, the healthcare provider will ask about your childhood history to see if symptoms were present then. They'll also inquire about current struggles and conduct mental status testing. Here's where you'll describe your experiences and any challenges you're facing. Remember, the earlier you seek help, the sooner you can start managing your symptoms effectively. Next up is the assessment. Healthcare providers use various tools to diagnose adult ADHD, one being the DSM-5, which lists specific criteria that must be met for a diagnosis. For instance, there are different types of ADHD: inattentive, hyperactive, impulsive, and combined. Each has its own set of symptoms. To receive an inattentive type diagnosis, you must have 5 or more symptoms of inattention lasting at least 6 months. Some common ones include trouble focusing on tasks, difficulty maintaining organization, and frequent forgetfulness. On the other hand, a diagnosis of hyperactive, impulsive type requires 6 or more symptoms of hyperactivity and impulsivity lasting 6 months. Examples include fidgeting, talking excessively, and acting without thinking. Important note, these symptoms should have been present before age 12 and persist into adulthood. But wait, there's more. A diagnosis of ADHD in DSM-5 also requires evidence that these symptoms significantly impair social or occupational functioning. This means your everyday life and responsibilities are genuinely affected. Your healthcare provider will also look for evidence of other conditions that could mimic ADHD symptoms. This helps rule out other possibilities and ensures an accurate diagnosis. If you think you might have ADHD, don't hesitate to reach out to a qualified healthcare professional. With the right support, you can find strategies to help manage your symptoms and live a fulfilling life. Here are some additional ways to tell if you may have ADHD. Number 1, you're easily distracted. Do you find yourself constantly pulled in different directions by external stimuli? Perhaps a simple walk in the park becomes an impromptu tour of every flower and tree, or a focused work session turns into a treasure hunt for misplaced items. If this sounds like you, You might be experiencing the effects of ADHD. The attention required to stay on task can be a real struggle, especially in a world filled with constant distractions. However, it's important to remember that occasional distractions happen to everyone. Having ADHD means that these distractions have a significant impact on your life, making everyday tasks feel like an endless game of find the focus. Number 2, you struggle with time management. Does time seem to slip through your fingers? Do you find yourself frequently late for appointments or struggling to meet deadlines? This could be a sign of ADHD. People with ADHD often face challenges in planning and organizing their time effectively. Deadlines loom large, yet tasks requiring time seem to stretch on endlessly. Even with calendars and reminders, staying on track can feel like deciphering a cryptic code. But remember, effective time management strategies can make a big difference. Number 3, maintaining organization is a challenge. Do you find yourself constantly misplacing items or struggling to keep your living spaces tidy? Perhaps your keys, wallet, and glasses have a mysterious habit of vanishing right before your important outings. Or maybe your workspace resembles an abstract art piece rather than a well-organized study area. These common occurrences can be attributed to ADHD. People with ADHD often face challenges in maintaining order and structure in their daily lives. Simple tasks like keeping a clean room or organizing files can feel overwhelming, yet with the right organizational tools and strategies, you can turn the tide in your favor. Number 4, forgetfulness plagues your daily life. Do you frequently find yourself in situations where you can't recall crucial details? Perhaps you're engaged in a captivating conversation only to realize you can't remember the previous point. Or you might be preparing a meal, but important ingredients mysteriously vanish from your memory. If this sounds familiar, you might be dealing with the consequences of ADHD. People with ADHD often experience challenges with short-term memory and forgetfulness. Remembering appointments, completing tasks, and recalling information can be a daily struggle. However, there are strategies to help you conquer this aspect of ADHD. Number 5, you have coexisting conditions. Living with ADHD often comes with a unique set of challenges. Anxiety and depression frequently join the mix, creating a tangled web of symptoms that can be difficult to navigate. When these conditions coexist, daily functioning becomes a balancing act. Simple tasks, like getting organized or meeting deadlines, can turn into stressful battles. However, addressing both ADHD and coexisting mental health conditions can bring about positive change. With proper diagnosis and management, you can find ways to regain control and live a more balanced life. And now we come to the next stage, treatment and management. The good news is that effective treatments are available. Therapy and support groups can teach coping mechanisms and life skills, while medication can help manage symptoms. Remember, you're not alone in this journey. Reach out to healthcare providers and connect with others who understand what you're going through. So how do you know if you might have ADHD? Well, it's not just about being forgetful or easily distracted. It's about whether these traits have a significant impact on your daily life. So pay attention to these signs. Be proactive and seek help. After all, knowledge is the first step towards empowerment. And you deserve to live a life that's not held back by an undiagnosed condition. Thanks for watching. Don't forget to like and subscribe so you never miss an informative video. And if you found this video helpful, please share it with your friends. Your support means everything to us. Stay healthy and happy. Goodbye.